Thank you so much for joining me today. Today is about life change. We want you to take hold of the life you're promised. I want to congratulate you for taking this time out of your day to further your own education, to be able to make an educated decision for your health. We do things differently at this office, and we want to make sure that you're a right fit for us. And so that's why that you're getting this video that is important to watch it in its entirety so that we don't waste your time and that our time isn't wasted either, because we're known for what we do, and it's about your health and it's about our reputation. We get results, but we want to work with the people that make the most sense and are the right fit for what we do. So today is going to be about bringing that broader understanding what's going on in our healthcare system, in the issues of why people aren't finding the answers to their health, why they just keep going down the rabbit hole of medications and surgeries and therapies and things that aren't getting them to results, getting them to resolve. All right, that's what we want for you. We want results. And so today is going to be about making that change. We're going to be going through and we're going to be talking about these things that allow you to give you the life that God prepared for you. He prepared a life of life and vitality, not of sickness and disease. We were meant to be vibrant and to give back and not just get through the day. And so that's what we want to help you with, and no matter what you're dealing with. And so when this comes down, I ask a lot of people, do you believe that there's a health crisis in America? And it's usually unanimous. We know we have an issue there. But the problem is we don't know what the answer is. And so that's what I want to help prepare you with today, because the issue is we're getting the wrong information from media, from articles, from the news. We're bringing all of this stuff in, and then we're supposed to use that to get us healthy. Another question I have for you is, do you want your doctor that's giving you health advice to have only taken one vitalistic or nutrition class in their entire program? Because unfortunately, our medical system, for our medical doctors, only have to take one nutrition class throughout all undergraduate and graduate programs. And one of the biggest killers of us in the United States is weight-related and obesity disorders. So I have an issue with that. I have people say, well, doc, you're just a chiropractor. Why would I listen to you when it comes to my health? And that I laugh at a little bit, because now, is there great medical doctors out there? Yes, absolutely. But just like myself, they had to go out and get the information that they needed to properly give you true health. Because my postgraduate study is in those things like nutrition, vitalistic healthcare, functional endocrinology, those things that truly get us to a point, an end game of health. And so what we need to do is look at, why is there a health crisis there? Because we're getting the wrong information. We're being lied to, actually. How come one time on the news you'll hear, it'll say, oh, make sure you only eat the egg whites because the egg yolks give you high cholesterol and heart disease. And then the next article says, make sure you eat the whole egg, it's a perfect protein and it all works together. And then you go to a restaurant and it says, oh, this is the healthy fit option, here's the egg white sandwich. Or you say, oh, well, no, we're supposed to eat whole grain toast, or no, we're supposed to eat wheat toast, or whatever it may be. Well, which is it? Which is it? And I call that combing through the cobwebs with our practice members, is working those things out. All right, we want to educate you, teach you to those things that are going to get you healthy and keep you healthy. Whether that's you have a thyroid condition, an autoimmune disorder, digestive issues, colitis, Crohn's disease, IBS, diabetes, just want to lose weight, or just want to get healthy. That's something that we want to help you get there so that you can continue to do it the rest of your life, and you don't have to rely on me or other doctors, lab testing, drugs, but you can focus on the power that God gave you to give you that for the rest of your life. Because unfortunately, this information we're getting is due to a money trail. It's all about the money. All right, between whether it's our insurance companies or drug companies. Now, I want to give you a quick global perspective here when we're talking about drugs. Drugs are necessary at points in times. They save people's lives. I don't deny that. But the issue is, the United States is only 6% of the entire world's population. And we take over 80% of all the world's drugs. Now, I have an issue with that. Okay? That's absurd. What we think is normal in the United States is absurd to everybody else. In fact, the United States is dead last in healthcare out of all industrialized nations. We're ranked 37 out of 37. Now in crisis care, we're number 1. So I'm thankful for that. If I have a gunshot wound, or if I were to be hit by a bus and my leg get cut off, all right, or if that happened to you, God forbid, don't come knocking on my door. Go to the hospital. We're the best at that. But if it comes to our overall health, unfortunately, we don't have an answer for that. And here's a couple stats that lead to that. 85% of all medical procedures and surgeries are scientifically unproven, from the British Medical Journal. Pretty self-explanatory there. That's scary when I talk about taking to my family to these places that they're supposed to have our best interests. 90% of all diseases prevalent today are not treatable with orthodox medical procedures. Now, this isn't Dr. Brandon's thoughts. This is from the World Health Organization, okay? What does this mean? This means that 10% that they can take care of is that crisis care. That's what the health insurance card in your pocket pays for, is crisis care. Whether you think it's preventative or not, okay? Unfortunately, it isn't. It's for crisis care only. What we think is preventative care is so far from the truth. This 90% is health, our overall health. And so what we've got to do is truly address this part of our bodies and allow us to get to a place where our lives can be changed forever. Because if we keep focusing just on the 10%, good luck at getting our country healthy. We're going to continue to be sick. And so this is what we want to do is allow for you to deal with these medical procedures. In fact, we're causing many of these. Let me give you an example of that. If you have high blood pressure, you go to the doctor, he gives you blood pressure medications. Will that lower your blood pressure? Absolutely, proven to do so. Practically it happens, okay? But then what happens the next morning? You wake up, your blood pressure's high again. So what do you have to do? Take that medication. And then what about the next day and the next day and the next day? You have to continue taking that medication every single day, and you ask your doctor, how long do I need to be on this? And he says what? Forever, right? The rest of your life. Same with diabetes, same with other chronic conditions. That's what they tell you. I want you to know here that we reverse those things. We see it happen all the time. All right? Not because that's what we treat, but because your body has the ability to heal itself when you give it what it needs and remove what it doesn't. And so with that high blood pressure, what we're doing is we're taking an acute condition that we could have treated naturally, and we've now made it a chronic condition that's untreatable by doing this over and over and over again. If you take your car in every day and get the engine light turned off by a mechanic every single morning, is that getting your car healthier, or is that causing it to break down? Right? That's causing it to break down. And so that's what I want you to start to think about, is what do you need? Now, I'm going to give you more information here about how to be a holistic doctor than you've ever learned before. Let's say you have a plant out in front of you. All right? Out front of your house, you've got this plant, you love this plant, but it's starting to wither and die. And so what does it need? That's not a trick question, right? Water, sunlight, and maybe it needs some nutrients or repotted, some new soil, okay? That's what a plant needs to survive. Now, what if your neighbor comes over and pours a quart of motor oil in your plant? Is more sunshine going to keep that plant alive? No, right? Is more water going to help? No, all right? Is going to putting new nutrients into the soil or proper nutrients into the soil going to help? No. It's already inside. And that's what happens with us, as we've got these things that are affecting us from the inside out, and we're not addressing the whole person. We've got to look at it together, because that wrong or lacking information is causing us to go backwards instead of forward. I see infomercials about the next greatest thing or the new greatest diet, and from paleo to ketosis to this to that and Atkins and you name it, okay? Do they last a long time? No, they're all fads. We know what works. We know how to get you healthy. But that doesn't make a consumer money, and that's the issue. And so that's what we want to do, is help to do this in a way that makes sense. Wrong or lacking information, right? You see things like this, the ab lounger, and the girl with the 8-pack of abs on it that's doing those crunches. I promise you, she didn't get it from crunching her fat together on this machine. Didn't get there. Did you know that, has anyone ever walked on a treadmill and watched the calorie counter as you're going along? If you haven't, trust me, it's depressing. even at a moderate speed, you'd have to be on that treadmill for 2 hours, just enough to burn enough calories to eat a Kit or a Snickers bar. All right? That's no fun. And then as soon as you step off of that treadmill, the fat burning has stopped. And in fact, if you're doing cardio exercise for longer than 20 minutes at a time, your body's actually going from fat burning to fat storing. These are huge issues that people miss all the time, and these are some of the things that we're going to help you get to so that you can get true health. Now, if we're to gain 1 pound of muscle to our body, we burn 1,500 calories just sitting on the couch after we're done with that workout, every single month. If you gain 5 pounds, that's 7,500 calories a month just to maintain that muscle while you're sitting on the couch. Now, does that sound more attainable and something that makes sense long term to get to the goals you want? Or do you want to spend your entire life on a treadmill, right? And this is when we talk about situation with our program, you're not in the gym for more than, we start you out at 10 minutes 3 times a week. No more than 45 minutes 3 times a week. I don't ask you to do anything I don't do myself. All right, proven results. We have people in our teens to 90-year-old people in our program. So if you think you can't do it, you can, because it's custom. We can make sure that it fits to you specifically. So we've got to be proactive. Some people will say, oh, well, doc, I have a fitness program. I walk my dog every day. And although that may be good for your cardio health, it's not a proper fitness program. All right, I'm not saying don't walk your dog, but sometimes I see things like this. All right, it might be good for your dog, but it's not going to be good for your health. We need to be proactive. And you can think of certain people in your life or things that, like Jack LaLanne, or these people that took hold of their health from the beginning and they didn't need someone to take care of them. And so that's why I ask you, what's your why? Why is this important for you to make a change in your health? You say, oh, well, I'd like to feel better. I don't want to be on medications anymore. But what are those things not allowing you to do in your life? Maybe it's you can't do the things you want with your kids. Maybe you can't walk for periods of time and spend time with them. Maybe you can't get on the ground and play with your children. Maybe you can't travel, which doesn't allow you to spend time with your family. I don't know what it is for you, okay? But that's what's important, is why do you want to do this? Because a simple idea of, oh, it sounds like a good idea, that's not going to get us where you need to be. We need to know why do you want to get there? And that's stuff that we're going to uncover and we're going to go through with you and make sure that we can get you on the right path, that we can align your goals with your desires, the things that you want to do and how you want to get there. Okay? This is my wife, Dr. Natalie, and our daughter, Brooklyn. And they're my why. This is why I do this, is so that people's lives can be changed. All right? And the real thing is because my daughter depends on me. She depends on me to take care of her in this time in her life. But my real why goes farther than that, and that's because I don't want the end of my life to be my daughter having to take care of me. I want her to enjoy her life, and I want to enjoy her life with what I have. Okay? And so if we don't have a plan to stay healthy, stay out of assisted living, stay out of sickness and disease, good luck. Okay, because average America right now, if you're 65 and older, are on 9+ medications, and by the time we're 78 and a half, that's when we're going to die. Our average mortality rate in the United States is 78 and a half years old. Okay, so if we don't have a plan, that's not good. That's what we're looking at. When the Bible and Harvard research says that we can live to be 120 years of perfect health. And I get it, that may not be your goal to live to be 120 years, but do you want to be healthy for the years you do have? Then now's the time. Because your health can be defined like this, in a simple term. It's your ability to adapt to stress in your environment. If you can properly adapt to stress, your body will heal, adapt, and recover, and be what it's supposed to be. Our body's constantly turning over new cells. We have a completely new body every 7 years. So we can heal, even if you've told you can't, or this is you're doomed, or this is your diagnosis and you have to live with this. I don't believe that. That's a lie from the devil. We need to get to the bottom of this. And so what we've got to do is first is identify where the stress is in our life. Now I'm going to go through this, and yes, some of these stresses we'll never get rid of in our life. Some of them we can reduce or minimize or remove. but the real goal is to adapt better to these. And that's what's going to get us to where we need to be. Number one, physical stress. So physical stress are slip and fall, car accident, or our micro traumas, the day in and day out stress. Maybe you sit for long periods of time, or maybe your job has a certain activities that continues to put stress on your body day in and day out. So that's number one. Number two is chemical stress. This is the air we breathe, the toxins we put in our body, the food we eat, the drugs we take, the water we drink. Our government decided and said that fluoride and chlorine are good for us. And in fact, they're neurotoxins. They break down and they form up in our cells and they cause all sorts of issues. Cancer, chronic disease processes, inflammation. All right, and so this is what we're dealing with. So we want to educate you on these things and show you what you need to do to overcome these. And lastly is your emotional stress. Now this is the most stress that we have throughout our lives, is that emotional, mental, or spiritual stress. And so how can we, again, best adapt to those things? What's going on within our body that's not allowing us to do so? And that's where a starting point is to work against these to get you from death to life. So, I like this definition. It's a great reminder. It kind of gives us a purpose of where we need to do. But purpose of food, that which is eaten to sustain life, provide energy, promote growth and repair of tissues. Now, is that bag that hands you out the window, does that sound like this right here? Promote growth, repair of tissues, provide us proper energy. Normally we think food's the enemy, and that's what's made me fat, and this is why this, and I can't do this, and I can't do that. When people join our program, it's such the opposite of that. We just have the wrong mentality of knowing what to do and when to do it. Now, within this, we don't starve you, right? We're not making you work out 7 days a week. In fact, it's usually the opposite. All right, we've got to do less with that. And then also when it comes to our food, normally I have to encourage my practice members, you need to eat more. A lot of times it's not enough. Now we need to get the right calories, things that are nutrient dense. And that's what changes your cravings you have. You say, Doc, I'm just a carb craver. I have to have bread. Or sweets are my thing, doesn't matter. I can't pass a McDonald's without getting a sweet tea or eating a cookie. I get it. I used to be there. I used to struggle every day, day in and day out with that. But until I did this program, I never knew how much it would change my metabolism, of how my body would crave things, how it would change that. And now I'm in the best shape in my life. And that's why we do this, because I want that for you. And I see that all the time. You can go on our website at exodushealthcenters.com and look at our testimonies and see other lives that have been changed. And I encourage you to do so. Because there's another part of health that's a lot of times missed and or managed way wrong, and that's our hormones. All right. A lot of you say, yeah, I've done hormones, I've done hormone replacement and creams and pellets and this and that. And unfortunately, that may only get you to a certain point, right? You say, yeah, I felt good for a little bit, but now I don't again, or now I have other symptoms. And that's an issue because you're only addressing one part of your health and you're not doing it from an inside out approach. Because even if your goal isn't to be fat burning, we need to be dominant in these factors over here, because this is what's going to allow us to be healthy and stay healthy. But what happens is through our lifestyle, through the food that's on the shelves in the grocery stores, we tend to get into this fat storing mode. Most people are here. And when we're dominant in insulin, estrogen, or cortisol, when we start to have cortisol issues, maybe you can't fall asleep easily, or maybe you wake up a lot in the middle of the night, or that crash in the middle of the day, and doctors aren't testing it at the right time, and I'll go into that a little bit later here. A lot of people don't realize insulin's a hormone. And they wonder about their diabetes. We see people's diabetes reverse all the time in this office when they've been told they have to be on their insulin or their medication the rest of their life. And that's not something we want for you. We want to get you into health. So, I want to tell you a little bit of story here. This is David. He's one of our practice members gone through our program. And so David was on blood pressure medication since he was in his 20s, cholesterol medication, 2 diabetic medications, and insulin. And he had been on all of those at least for a decade. All right. Doctors actually told him he was a type 1.5 diabetic. All right. Now they're just making stuff up. All right. He was type 2 diabetes, and that's what we had seen great results with. And within joining our program here, not only has he lost a lot of weight, in great shape, but through that program, he is now off all of those medications. He's free of his diabetes. We got his follow-up blood work recently here, and his A1C is now completely normal. He has completely reversed his diabetes. His sugar levels are stable, the best they've ever been. And so he felt like there was no hope. He felt like these were the things that he had to do because that's what his doctors were telling him. And I want to break that in you right now. If you've been told this is your diagnosis, this is what you're going to live with, you've got to break the chains. All right? You've got to open the doors that have said can't be opened and close the ones that they said can't be closed. And that's something you've got to do through yourself. But you need sometimes some help to do it, some guidance, some mentorship, and that's something that we can provide for you to get you there when everyone else you've gone to keeps telling you the same thing. We want to look at it a different way. So a lot of people will say, oh, well, I've tried this, or I've done this, I've tried everything, I've tried diets and exercises and this and that, and this worked for my neighbor but it didn't work for me, or my husband this worked for and this didn't work for me, whatever it may be. And the issue is because you're trying a general approach for a specific person, because everyone's different, and these are just a few body types. If we have a body type that looks more like this over here, it's an estrogen dominant body type. We have issues metabolizing estrogen, removing it. This is an adrenal base. So this is again something that if you may have heard of adrenal fatigue, or you have tiredness and you're tired all of the time. A lot of times you fit into an adrenal issue. This one right here is thyroid. Almost every thyroid hormone in your body goes to almost every cell in the body. So it can affect the overall demeanor of the body as a whole. And this last one is a liver-based body type. And so those are the things we need to start looking into, is finding out, all right, where are you? What is going on with you, and how are we going to address it properly? So the thing is we need proper diagnostic tests. Otherwise, we're guessing. All right, I'm not going to guess like your other doctor. Sure, we could sit down and say, yeah, this sounds like that. But when we can really find out the answer and look at it and then see objective changes, that's where we can continue to get you to where you need to be. Because so many people come and their lab tests are normal, but they still have symptoms. Or they were abnormal, got this medication or an endogenous thing, this shot, pill, surgery, whatever it may be, and now their lab tests are normal. Great, we're healed. But yet we're not, right? We still have symptoms because it didn't get rid of the cause of the problem. So let me show you an issue here. TSH, if you've ever had your thyroid tested, they tested TSH, all right? I can give you that. However, did they test anything else? Probably not. Maybe one or two other factors of your thyroid. There's over 8 markers of thyroid to look at to find out exactly what the issue is, or even if those are out of place, is that even what caused it in the first place? But let me show you an example. So TSH. So what you have is you have your blood range that you'll get from a blood lab. And with TSH, they'll say, all right, if you're at 0.3 or below, you're abnormally low. And if you're at 5.7 or above, you're abnormally high. All right? And that's your normal range. As long as you're in here, that's normal. All right? That's not normal. In fact, how they can call it normal is beyond me. Do you know how they come up with the normal blood ranges that you get from your labs? Is they take a large population study, and this can be people that are sick and dying, healthy, everyone in between. They just take those lab tests, they do an average of them, they cut off the top percent, they say you're too good, the bottom percent you're too bad, and then here's your bell curve. So what this range is right here is average America. Right, I already talked about what average America is. We're sick and fat and nearly dead. And that's not what we want. We want to get into health. And here's the other, even if you say, okay, I get that, but even if you don't, do you want to wait until you're almost abnormally low with your TSH before you do something about it, or almost abnormally high? Because the issue is the reason your doctors aren't addressing it until then is because that's when it's considered pathological. That's when they can prescribe you medications. Technically, if they prescribe you medications for this in this range, it's malpractice. Because they don't look at functional health. They wait until there's a problem, and then they try to double back. So what we want to do is stop this before it starts. We actually look at this as a functional lab range. All right? With your TSH, we want to make sure you're between 1.8 and 3.0. And in fact, sometimes you need to be at this higher range, especially I see people that have migraine issues. If they're a little bit lower, even in a functional range here, if we don't address this to here, then that continues to happen. So there's so many factors that come into this. And if you don't have someone looking at the whole picture, you're not going to get the right results. Because if you go from specialist to specialist to specialist, and they only look at one part of your body and one part of your health, how does that ever bring everything together? It doesn't. They just say, all right, great, now your TSH is in a great range, but your liver's not doing what it's supposed to, your brain's not sending the right signals at the right time, your body's not detoxing the things out that it needs to, then it's all for nothing. So I don't want that for you. I want to get you the right thing. So let me show you a couple other tests. Testosterone, if you do it with blood, between 200 and 800. What a wide range. Yeah, we want to look at this functionally. We want it to be between 250 and 650. All right, so if we have issues, sex hormones, maybe that's poor libido, maybe you're just, having other issues, tiredness, not feeling the energy anymore. We've got to look, all right, where are these things coming from? Because it could be testosterone, or it could be cortisol, could be thyroid, could be a nutritional deficiency. Those are things that we've got to find out. The other one being cortisol. If you've ever had your cortisol tested, they probably tested it one time and they tested it in the morning. Why? Well, because you're probably not going to go back to the lab 4 to 5 times throughout the day. Well, they test it in the morning to match up with your circadian rhythm, and in the morning, of course, it's going to be as close to normal as possible because that's why you're awake. That's what got you there. But that's not usually when cortisol is an issue. Cortisol should run along this parameter here. But what happens is look at this. These purple dots, this is what your cortisol might really be. All right, you were normal when you got it tested, but what about mid-morning? What about the middle of the day when you started to crash? What about at nighttime? Maybe this starts to rise again and you have issues falling asleep, but they're not looking at it functionally. They're looking at it pathologically. So this is a test that we have you do urine-based, you do right at home, you do 4 to 5 times throughout the day so we can truly get a pattern of what your cortisol is doing, what your hormones are doing. If you have melatonin issues or if there's oxidative stress, all of those things together. And so we want to really test these things and not guess anymore, because that hasn't got us to a place that we want to be. So what we've got to do is we've got to put all the pieces together. Now this is the foundation of what's so important and why our program works when everything else you tried hasn't. All right? Number one is we've got to treat the whole person by putting all the pieces together. You're not a pancreas, you're not a thyroid, you're not a heart, you're not lungs, you're not a digestive system. You're all of those things together and they all work together. So we've got to look at them together. Number one, nutrition is critical. Okay? Yes, most people agree with that. We've got to have proper nutrition. But that's not the only part of health. All right? You can say, hey, I've done diets and my diet's good and clean things up. Great. But even if you have a perfect diet, these other things, if they're not in the right place, we're not going to get results. The second being fitness. All right, we talked a little bit about that. And this isn't working out 7 days a week. All right, this is getting so your body can recover. This is building muscle. This is doing cardio efficiently and not all day. And so those are the things that we'll fine tune for you. But it's critical that we have it and we have a plan for it. This third one is our hormones. If our hormones aren't right, then it's going to affect everything else we have. We've got to have sunscreen, right? Or else we're going to die of skin cancer. I don't have time to get into all of that, but there's so much bad information about that. The other thing is what that's caused is we're all deficient in vitamin D now. And so if we don't have the proper amount of vitamin D, that's what helps create the base and the backbones for our hormones. And so I see so many issues right there. And then even if we are getting vitamin D, is it converting properly? Is it getting to where it needs to be? So our hormones are critical in our health. The third is your nervous system. All right? Now all these components are critical, but your nervous system is the conductor. It tells all of these things what to do and when to do it. If your brain doesn't tell your heart to beat, your lungs to breathe, your gallbladder to produce bile at the right time, these things don't happen. Just think of it as simple as this. Let's say your brain's sending a signal to your digestive system. You have digestive system problems. If somewhere along the way there was pressure on that nervous system or tension on those nerves, that's going to change the signal going to that organ. It's going to change how it functions. It's going to change how it recovers. It's going to change how it adapts. And so this is the base of what we need to do. We need to make sure your nervous system's functioning properly. And so what we do is what's called torque release technique. It's a nervous system adjusting model. We don't twist or pop your spine. It's very gentle, and it allows for your body to make those changes from the inside out. This is something I teach a 3-day seminar across the world. I'm a professor, and I'm going to keep it as simple as that. If you want to know more, you can learn more on our YouTube site or come to our office and we'll show you a more specific look at that. But it's effective, it works, and it will change your life if there's pressure on that nervous system. And then lastly being detox. Now this is a buzzword. Now I don't want you to be scared of this. This isn't like we're gonna make you drink juice or not eat or be on the toilet all day. It's none of those things. You eat during our entire program. You're not on the bathroom all the time, nothing like that. But we've got to do it properly. Some of you go, oh, I've done a detox before. It didn't do anything for me. Or it helped for a little bit and then I went back to the way I was. Because people do it wrong. Everyone's doing it wrong. You may detox some things out, you put it into your blood, but if you didn't clean up other parts of your body, you say, oh, I did a liver detox. Well, are your kidneys then pushing it out of your system, or did it go in your blood for a period of time and then go back in your cells once your detox was over? These are the common mistakes that we see all the time, and we don't want you to waste them as well. It's going to waste your time, it's going to waste your energy, and it's going to waste your money that you're putting towards these things. We want to be efficient. Now, the issue is 94% of all failure is due to not having a system. You have to have a system in place or you fail. All right? You may say, I say, hey, I've done calorie counting, I've done this program, and yet I may have got results, but then 84% of people gain that weight back or 30% more weight than what they had lost. And that happens so much because those systems are not attainable, sustainable, or permanent. All right, the emphasis on permanent. What we're going to do is we're going to show you this. We're going to create a program customized to you that will be permanent, that you can do the rest of your life. So that when you're done with this program, you don't need me anymore. You can do it on your own. And you'll know which decisions to make when the next fad or diet comes up, or you see the next thing on the shelf, or the things that come around, or the new fitness program. We're going to help you again, like I said, clear through those cobwebs so that you have a clear focus and vision on what you need to do. Now, tell me and I may remember, show me and I will remember, involve me and I will understand. This is critical, all right? We're going to involve you in the process. This isn't going to be like when you go to your doctor and he just tells you what to do and sends you with a script and do this and gives you no guidelines or what to do it or why it's important or where this even came from. We're going to show you the why so that it makes sense to you, that you can attain it forever. Then you can help other people, all right? Help others through what we do. Now, the question is, can you predict the future of your health? And I hope so far after looking at this, you realize that there's more hope than you ever thought there was before. Because we can, but we've got to do the right things. You need to order the correct tests. Now, if you've had recent blood work or testing or hormone testing, please bring it in. I will look at those. We'll see if there's anything else that we need, and we'll go from there. All right. Now, if it's up in the attic somewhere and you're going to fall through and hurt yourself, don't worry about it. But if you have them easy on hand, you can bring them with you at your first appointment. The second is we've got to determine the true underlying cause of your problem, because we do not want to focus on your symptoms. If we focus on your symptoms, good luck at getting healthy. Now, we want your symptoms to go away, but we've got to get rid of the cause of that. And we can't do that just by altering the labs with drugs. We've got to correct the dysfunction in the body. Find what's caused it to happen, all right? Like the plant. Right? The plant that was dying. What does it need and what do we need to remove? That's how you need to look at your body. You need to look at your body with the end in mind, like Stephen Covey says. You've got to look at it with the end in mind. And if you don't do that in procedures or decisions you make or things that are going through, then unfortunately, a lot of times you're going to have buyer's remorse, or you're going to be in worse of a condition than you were before. And we want to help you avoid those mistakes. Address the body as a whole and not individual pieces with a systematic approach. Did Michael Jordan need a coach? Absolutely. You can't just throw the 5 best people out on the court and hope for them to win. You've got to have a plan. You've got to have a plan and you've got to put it together. You need mentors in your life. All right, health mentor, maybe a business mentor, a life mentor, right, whatever it may be. You need those mentors so that they can help you. They help hold you accountable, get you to those results that you've wanted but haven't been able to do on your own. all right, through that mentoring and coaching that we do here at our office. We have a registered dietitian on staff. We have a fitness expert on staff as well. And so these are things and resources that we're going to have for you that's going to enable you to get to where you need to be. Now, what does this all come down to? Because after this, you can say, Doc, that's great information. I'm going to take that and I'm going to use that. And they say, oh, you know what, that's great. I'm going to think about it. I'm going to think about it and I'll go from there. How many times do you think that those people actually followed through? That they actually picked up the phone or that they did something on their own? Never, okay? It doesn't happen. It's the human condition. It's our biggest infirmity. We're indecisive. We don't know when to make a decision. We just hold it off. We'll say maybe next year, maybe next week. You've already been thinking about this. All right, that's why you're listening. That's why you're still listening. And I want to congratulate you for still listening at this point in the program. Because if this is truly a goal and what you want for you, we want to help you get there. All right, and so how we do that is through our Peak Lifestyle program that we create for you through a complete wellness evaluation. All right, the first part of this is going to be a consultation with me. All right, I've spent this time with you, so now that when we can sit down together, we're on the same page. I don't have to explain to you why insurance doesn't pay for the things that get you healthy, or why it's important that we address our health from the inside out. Now we're on the same understanding. Now when we sit down, we can get down to business, and we can spend this time with you. Now your doctors, when you go and see them on average, the average time that the doctors are seeing people right now is 7 minutes, and they're charging on average over $250 per those visits. Now that's what they're charging you. Your insurance copay may be something different. But if you were to go in and pay out of pocket, would you pay that $250? Or I've seen them $450, anything in between? And you may, for some of those visits, some of you say no way. Well, if you wouldn't, there's a value issue. All right, and so you have to value what's going on. You have to make a proper investment and not an expense. And so that's with this. I've already spent this time with you. Now when we sit down, I'm going to spend up to another hour with you at this consultation so that we can sit down. I'm going to sit with you knee to knee. All right, I'm not going to wear a white lab coat to intimidate you. I'm not going to sit across from a big scary desk. We're going to sit knee to knee so that we can get down to the issues that are going on with you. All right, and if we need an hour, we'll take an hour to be able to do that. We'll give you your wellness evaluation, which you'll fill out ahead of time, okay? This is a very advanced evaluation that we're going to give you with certain objective things that you're going to fill out, and we're going to actually start asking you questions that no one else has asked you before. And so that's important so that we can get down to the bottom of what's going on, create congruent goals, and create a program that makes sense for you if you're a right fit for our program. And then the last part is once we go through all of that at that first hour appointment, I'll come up with a plan of action for you of where we say, great, you know what, you're a fit for this program. Now this is what it's going to take to get you healthy and keep you healthy. I don't compromise. I don't compromise on these things because it's your health and it's our reputation, and we get results, but you have to follow what we do. All right. Now it's not that, oh, you know, I work better like this or like that. Like I said, this is customized. We're going to get it for you, but you've got to understand that we have direction. We have a program that works, and it can work for you when you apply what needs to be applied for that. All right. So that first visit, and what you're going to do is today is you'll call and you'll make an appointment for this. All right. And after with this, listen to this webinar, you'll get our discounted rate to come into the office and to come in and get that first evaluation to take a further look into what you have going on there. All right. With that complete wellness evaluation, the consultation and plan of action, all done at that first hour appointment, the total value for my time is normally $287 per hour. But as a bonus for you, listen to this webinar fully through and taking a true step towards your health, we're going to reduce the price $200 for you. And so your investment is only $87 for that first appointment, where we'll sit down and we'll go through these things. Now you say, what's the catch? All right, well, there is a catch. All right, I have 3 rules. Number 1, you need to be on time for your appointment. If you're not, it's going to cut into that time because I have people each hour that are coming to office. We're very, very busy. Okay, and so I want you to know that you need to be on time. The second, and the one that I see most people miss, and unfortunately they miss time in their appointments, is when they don't fill out their paperwork completely ahead of time. You must fill out your paperwork ahead of time. It could take 45 minutes for you to fill out. It's very extensive. So when we do that, that's something you're going to look at and make that address, get that taken care of, so that when we sit down we can get right to work. All right. And then the third thing is, if you're married, you need to bring your spouse. All right. That's critical. We're going over your health. It's a critical factor so that we can go through this together, that we can voice those things that have been going on. And maybe you've tried other things and your spouse isn't on board anymore, and that you've already spent a lot of money in expensive things that haven't worked. Well, we've got to look at why this is going to work for you. And if so, what's going to make sense? And then we need their support along the way. All right, it's free. They can come to all of your appointments, and for that first appointment, it's critical that they come with. After that, you're able to come on your own. But that first one we need to do together. Now, if your spouse also or an immediate family member wants an evaluation themselves, each additional person is only $47. And so that'll be that time that we can come in, sit together, and get you to where you need to be. All right. Now, a couple questions I normally get is, what if I'm from out of town? That's okay. We can do our program remotely. We'll get you the resources we need. We'll mail you the things that you need. We'll get you all set up. I have people in Kentucky and Florida and Michigan and all over the place. We can do that for you. Skype calls, whatever means that you have, we'll find a way to make that work. Okay? Also, people say, what about what's my investment for this program? What does that look like? Everybody's different. All right, I would love to sit up here and tell you this is how much it costs, but I truly have no idea what it's going to cost for you. It depends on how long you've been dealing with this condition, how many medications you are, what goals that you have, your ability to get things done. Those are all things that we're going to look at together, come up with a program. But I want to assure you that if this is something you want, it's not if you can find a way to make the investment, it's are you willing? All right, because I have people on fixed incomes in our office. I have single parents that are in our program, everyone in between. And if you're willing, we have outside financing options if you need them, and other things that will allow you to get these things so that it doesn't hold you back from the life that God's provided for you. All right, so do not hesitate. Call into the office. All right, take hold of the life that God has promised you, and do that today. Don't hold it off, because if you do, unfortunately, you're not going to do it later. I just see it over and over and over again. Even if your intentions are good to do so, it just doesn't happen. And so we're excited to serve you. We're excited to be a part of this life change that's going to happen with you. So give us a call. Our office is below this video, and but it's also 704-892-4545. You can email us at frontdesk@exodusclt.com, and also you can visit our website. It is exodushealthcenters.com. So thank you again. I'm Dr. Brandon with Exodus Health, and it's a pleasure to see you and serve you.